The poster describes the efficacy of nivolumab in patients who failed treatment with ipilimumab. This study was started 3 years ago and recruited across Europe more than 1,000 patients. So the interesting part of this study, which is a safety study, is that it included patients who had a poor performance status, ECOG-2. It included patients who had a serious autoimmunity, grade 3 or 4 after ipilimumab. It included patients with brain metastasis or severe autoimmune diseases. So all kinds of conditions which we had no clinical data in the clinical studies which were performed earlier, because these were exclusion criteria. So we wanted to get an insight in a patient population which is part of the real world, and to see whether we are accumulating larger patient populations in that circumstances. Actually, also patients with uveal ocular melanoma and mucosal melanoma are also usually patient populations which are excluded from clinical trials, were included into this safety part of this clinical study. 1,008 patients were recruited in total. All had pre-treatment of ipilimumab. And I think there are several interesting observations. So for the entire patient cohort, the 2-year survival is in the range of what we have seen with Checkmate 37. So survival above 30% after 2 years. If we look at the patient cohort which has been treated for 1 year, you see that roughly 25% of the patients stayed on treatment for a year. Majority of the patients obviously discontinued because of progression, but I think 1/4 of these patients still on treatment, demonstrating that pre-treatment with IPI, but also other kinds of treatment which was required, including BRAF inhibitor treatment, opened a new treatment option for those otherwise patients with other treatment options.